Welcome, everybody. Thanks for coming and joining us. I'm Dr. Ilker Afeyden. I'm really happy to be with you and meet you in Tel Aviv. And I guess I'm the only one who is wearing suit just now in Tel Aviv. Okay, we are waiting for this opportunity for a long time, but because of the COVID situation, we couldn't make it happen. Now we are here and we are happy. This is not the first time in Tel Aviv. 4 years ago, we were here with my family for my best friend's son's bar mitzvah. And yeah, it was amazing. We enjoyed a lot. Good food, lovely people, culture, and actually we are very similar each other in both most ways. And as Eyal said, we always feel home here, and I hope our Israeli guests feel home in Istanbul as well. We are working with Mr. and Mr. Eyal over 4 years, and we are not working just like an agency. We are partners, we are friends, family. We love to work together and enjoy our working. And we love to host our Israeli guests in Istanbul as well. As I said, I'm Dr. Ilker Afeyden. I am an aesthetic plastic surgeon who is operating over 30 years in this field, but I can say that for the last 15 years, I'm only doing hair transplantation. And I can say also that our medical team is one of the most experienced team in Turkey, because they are not freelance workers. We are always working together, and some of them we are working over 10, 15 years. They are dedicated to their work, and this gives us to do a precise work and to control every step of hair transplantation easily. I will not take your time too much about technical details and medical knowledge, but I just want to say something about the surgery day, what's going on the surgery day when our patients are in Istanbul. For sure, we are all doing accommodations, transfers, everything that make them comfortable. On the surgery day, early in the morning, we always begin with live consultation. Of course, we are making some estimations before they are coming, but live consultation is the most important part. And first, we listen our patients, and we are trying to understand their expectations. Because in hair transplantation, one of the most important things is the expectation of the people, not our job. Because I'm doing this job over years and years with the same instrument, with the same stuff, and we know our job. But what is different is the patient's expectations. We should understand, and it's not working, but you hear. Yeah. If we cannot set up the expectations regularly, even you do a perfect job, patient can be unhappy. That's why first listen, understand, and we should express ourselves, and we should tell people that what we can do for them. And then, if they agree, we can continue. In the medical evaluation in the morning, first, of course, we are checking for donor site, donor availability, hair quality, hair thickness, and then we are, of course, checking the hair loss degree, hair loss status. We are designing hairline, but of course, the hairline design is always discussed with the patient also, because their opinion about their hairline is also very important. And if everything is okay, all set, with realistic expectations, we begin. We begin with preparations, of course, shaving, dyeing, and it's always asked, can you do it without shaving? No, because if you are taking over 1,500 grafts, we should shave the patient's head. Unshaven fouet is just for small cases, not for severe hair loss cases. After preparations, there comes local anesthesia, and this is the most scary part, I think, for the patients, but it's just for 5 minutes in the beginning. Like in a dentist, very little pain while we are injecting, and then whole operation is done under local anesthesia without any pain. People are not supposed to feel any pain all through the operation. If they feel something wrong, any discomfort, they can immediately let us know, and we can put some more extra shots. That's it. It will be very easy and straightforward. There are 3 main parts during the operation: incisions, extractions, and implantation. First part will be the incisions part. I am doing this part. This is the main part of the operation, actually, because whole plan, whole design, distribution, the grafts angles, skin exits, all will be done in this part. We can call this part as an architectural plan of the operation. And if you have a plan, you will never end up in a mess. This is the most important part. Second part is my assistant's part, harvesting. We are getting the grafts out from donor side. It will take around 2-3 hours more. And last part will be the implantation part. After all grafts are ready, nurse team will implant all these grafts into these holes precisely. In total, operation takes 6-8 hours. It's not too bad. The most bothering part for the patient is lying too long in a bed without moving. It's very easy and straightforward. They can sleep, they can listen music, we chat together, we give some breaks in between these main parts always, and the lunch break, of course. Whenever patients want, they can ask for a break. And after we finish, a detailed information about the post-op instructions will be given. Next day, we are waiting for the patients again in the clinic in the morning for a short time, maybe half an hour. We wash their head and teach how they will take care of themselves in the next 2 weeks. This washing is, a special way of washing. It's not too difficult, but a gentle way of washing. They lather up on the back, on hands, and then tap the bubbles on top, and then just rinse without pressured water. And the next 2 weeks will be the critical period. And the most critical thing is the protection. We don't want any hitting, touching, rubbing, scratching, playing, checking. No touch is the most critical, important thing, because grafts are not really stable in their places in the first 2 weeks. We are just putting them into the holes, and then they can easily fall off. That's why they should be taking care of themselves, and patient will be the guard of his own follicles. This is for 2 weeks, and they will be lying on their back. We don't want any touch while they are sleeping with the pillow also. There will be some, in appearance, there will be some red dots and scabs on top. And with the help of washing, these red dots and scabs will fall off in 2 weeks again, and patient will begin to be normal after 2 weeks. And of course, every single patient have my personal phone number, and they are sending their photos, especially weekly photos in the first month, and then monthly photos all through the year, directly to my WhatsApp, and I'm making their controls. And this is the most important thing, because that's the only way that I can check their progress, and if something happens wrong, that I can immediately advise for them. Again. Okay, and this follow-up will be in the first year. Of course, there's a swelling risk because we are injecting a lot on top, and it's a surgical trauma at the end, and this swelling can move down with the help of gravity, and there can be a swelling around your eyes, especially on the third day, not in the first 2 days. But it's not dangerous to your health or operational results. It will continue moving down to your cheek, jaw, and then disappear. It will just happening and disappearing. Post-op medications are very important in terms of Propecia, Rogaine, PRP, IPRF injections. I know it can be a bit scary. All medications have some side effects, but it's always worth to give a try because these medications are not just for hair loss, to prevent hair loss. If you have an operation, they have some additional beneficial effects on the operation as well. You are supposed to get more stronger results with the help of these medications. And one of the most important things, final results will come after 12-14 months, not in the first few months, especially in the first 3-4 months. We are not expecting any improvement. It will be a very silent period. It can be very bothering, but patients must be patient about the results. And after 3 months, we will begin to see the improvement, and we can expect 10% increase in their density. And then after 40 months, we will say that this is the final result, and we are not expecting any more change. Okay, as a brief, this is the story of the surgery day, and thank you again. Thanks for inviting us again in Tel Aviv, and hope to see you in Istanbul. Yeah.